Infective endocarditis is a rare but serious infectious disease. It carries high morbidity and high mortality in those afflicted with this infectious syndrome. Studying the epidemiology to examine risk factors, patient characteristics that are more susceptible to developing infective endocarditis is critical. This leads us to our study in a population-based fashion of not only Olmsted County, but an additional 5 counties surrounding Olmsted County, which will broaden our population, enhance our evaluation of this population for future studies. Hello, my name is Daniel D. Simone, and I'm a consultant in infectious disease at the Mayo Clinic in Rochester, Minnesota. Today, I'm going to talk to you about our paper, a contemporary population-based profile of infective endocarditis using the expanded Rochester Epidemiology project. Infective endocarditis is a rare but life-threatening cardiac infection. There are multiple cardiac valve conditions that predispose patients to infective endocarditis, as well as patients who inject drugs. Management requires intravenous antibiotics, and in many patients, cardiovascular surgery. Our group has characterized endocarditis in population-based analyses of adults in Olmsted County, Minnesota, between 1970 and 2013, using the Rochester Epidemiology Project. Over this time period, there was no significant change observed in overall incidence of endocarditis and 6-month mortality. However, Staphylococcus aureus has surpassed viridans group streptococci as the leading causative pathogen. Age at diagnosis of endocarditis has also increased, as well as the increase in proportion of hospitalizations for patients with endocarditis who inject drugs. Using the Rochester Epidemiology Project, an analysis of endocarditis has been previously criticized due to the limited size of Olmsted County population to examine uncommon infections such as endocarditis. Furthermore, the demographics of Olmsted County limits the generalizability of our findings in areas with different population characteristics. Therefore, this is where we get into our study. With the recent availability of the expanded Rochester Epidemiology Project, or also called E-REP, has been used. With the expanded REP, we were able to include an additional 5 counties in addition to the Olmsted County in this study. This more than doubles our population size for the study. We included all incident cases of endocarditis between January 2014 through December 2018 to provide a contemporary analysis. The age and sex-adjusted annual incidence rate for endocarditis was 11.9 per 100,000 patients. This was similar to recent studies using a large national database. Older age and male gender were strongly associated with endocarditis. Staphylococcus aureus, again, was the most commonly identified pathogen, followed by viridans group streptococci and enterococcal species. Hospital readmission within 30 days post-discharge occurred in 28% of patients in the E-REP cohort. 6-month mortality rate was approximately 32%. This study is the first time the population-based expanded REP has been used to determine the age and sex-adjusted incidence of endocarditis. Older male predominance was striking. Injection drug use was infrequent in this cohort. However, this endocarditis risk factor deserves continued surveillance because of the ongoing opioid epidemic in America. The finding of this work will serve as a valuable benchmark for future comparisons of endocarditis using the expanded REP or E-REP. Thank you for taking your time to listen to this.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.